Good afternoon. I'm here to provide you with our daily COVID-19 update from the Department of Health. So today I can report that there are currently 6,825 confirmed cases of COVID-19 in Australia. Sadly, we've seen 95 deaths, and I express my condolences to all those who've lost loved ones. We are hearing reports from New South Wales and the media of one additional death. As yet, we've not had that confirmed by New South Wales Health, so we're saying that in fact there are no new deaths reported to us at this point in time. Really encouragingly, we've seen 650,000 tests now in Australia, and we're continuing to encourage anyone who might have even the mildest symptoms of cold or flu to consider going and get tested. We are expanding our testing across the country, and so we do, as I say, encourage you to do that. We have 28 people in intensive care today, and that's really encouraging. We're not seeing significant numbers in our hospital system. We want to maintain and sustain that across the country, and so we continue to say to people the importance of maintaining the social distancing, following our hygiene advice, and certainly, as I've said, if you are slightly unwell, please do consider getting tested because those services are available to you. Also, we now have more than 4.5 million downloads and registrations of the COVID Safe app. And again, really important, we're asking all Australians with a smartphone, please consider downloading our app. It is voluntary, but the more people we get downloading that app, the sooner the National Cabinet will have the confidence to be able to consider easing some of the restrictions that we're seeing across the country, that we can help return us to our normal lifestyle. So I'm happy to take questions.
Sticking with New South Wales, we're seeing indications that most students will be back at school by the end of May, but there are warnings that that may also lead to an increase in cases. Do you have any concerns there?
I think that we do know that there is a likelihood that we will see some increase in cases as schools go back. We want to make sure everyone is following those really clear instructions, particularly the adults, the parents and teachers, about social distancing and about maintaining that when they drop off and pick up kids from school, and also in those classrooms, where the teachers collect. So it is really important that we see that. We do know, however, that we may see some increase in cases, but we want to keep that well under control. So again, encouraging everyone to download the app in order that where cases do occur, we'll be able to follow them up quickly with the information available to us.
At the start of this pandemic, there was a strong message from the government and from the chief medical officers to respect frontline healthcare workers. There were some reports of people doing things like spitting on staff members, pretty horrifying stuff. Now that we're seeing an increase in the amount of people being tested, and that's potentially more people going through the healthcare system, are you hearing reports of this being increased, and what would be your message to Australians who are now getting tested?
Yes, thank you for the question around aggression towards healthcare workers. Unfortunately, we do continue to hear reports of that, which is incredibly disappointing. As a nurse in Australia, it is very sad to hear our frontline workers being attacked in this way, whether it's verbally or in any other form of aggression. That is not tolerated. We do not tolerate any aggression towards healthcare workers, and so we ask everyone to be respectful in their interaction with our health system, and that is an expectation we set.
To follow on, if I could, on that question, are you also seeing anecdotal evidence of frontline health workers being refused entry into certain buildings if they're wearing their ID or their uniform?
We are hearing some reports about people having concern with healthcare workers, and so the employers are providing often some advice to their health professionals to consider going straight home from work and not wearing ID, sadly, because of that lack of respect for our healthcare workers. And I reassure all Australians that our highly skilled and professional health workforce out there is well trained in knowing what to do to protect the community, and they should have confidence in our health professionals.
On the outbreak of cases at Newmarch House, the first reported confirmed case was over Easter. There are still new cases being identified well beyond that 2-week incubation period. Is that effectively a second wave of infections, given that had measures been put in place to stop the spread, there shouldn't be new cases emerging?
Yes, we are seeing an ongoing cases. These are being investigated by New South Wales Health. Each case is investigated in detail, and we will see over the coming time where and how those further infections may have occurred. But
given the prevalence of coronavirus globally, the fact that it's highly likely that other aged care facilities will have outbreaks, would you like to see the lessons of Newmarch, I guess, applied as quickly as possible, and how can we guarantee that those investigations can have some kind of result, some kind of lesson for the next outbreak?
So we're reinforcing the advice that's been provided to all residential aged care facilities in a number of ways. We're increasing the amount of training provided to health professionals in these facilities. Additional funding was provided late last week in order to support and recognise the additional cost that these measures are taking. And we provided very clear information and guidelines around how one should be screening the workforce and also visitors to ensure that we create the safest environment we possibly can for those most vulnerable people in these facilities.
There's actually going to be a protest outside Newmarch this afternoon. Some of the families and loved ones of residents who are either in lockdown or have sadly passed away. What's the health department's message to those grieving individuals?
Well, obviously we express our condolences to those who've lost loved ones in this outbreak, and we encourage the families to continue to talk to Newmarch facility directly on every occasion that they can, and we do respect their concerns that they are expressing during this outbreak, as it must be very difficult for them in this situation.
I understand that on the issue of community sport, the HPBC is providing advice before the National Cabinet meet tomorrow and then again on Friday to come up with some guidelines for sport recommencing. What kinds of things go into the consideration for reintroducing community sport, not just when talking professionals, but how do you, say, get a coach to tell their players to abide by certain things? It's going to be a bit of a task. How do you create guidelines like that?
I think that we've seen the Australian Institute of Sport provide some very comprehensive guidelines to sporting, particularly community sporting organisations, about the sort of measures they should be thinking about as they reintroduce sport into our community. And I think that they will help them see and understand the types of things they will need to do, and they can help work with their members and the team members and players of whatever sport it might be, how they also must contribute. And the things that we remember around social distancing and maintaining really high levels of hygiene during sport, as we're asking the general community to do.
On the same issue, when we say social distancing, that might be fine if you're playing tennis, but a little bit harder if you're playing Aussie rules. Are we potentially thinking that some sports would be reintroduced while others won't, or what's going on?
The advice has been provided to the National Cabinet, and it's been considered along with all of the other advice on restrictions and how we might carefully and appropriately consider the reduction of those restrictions. So sport will be a part of that, and it needs to be a considered approach and proportional. So I will leave that to National Cabinet to decide, based on the advice that has been provided, how and when we might see changes both in community sport and most generally in the restrictions across the country.
On our overseas borders yesterday, the Education Minister indicated the government would be willing to consider an exemption or a special allowance for international students to come back to Australia potentially before the borders completely open. Presumably you would expect they would have to quarantine, but it's going to be a larger number, probably more than the hotel system could cope with. What kind of considerations would need to go into allowing certain groups back into the country?
So again, the advice to the National Cabinet has been provided. It is ultimately their decision around how and when we might see a return of international students. We know the importance of international students to their education and to our economy, but that will be made considering the impact that might have on the spread of COVID-19, how we can ensure the security of people as they come in, and that we don't find any spread. So they will be considered along with a whole range of other aspects as we roll back some of the restrictions that we've seen in recent weeks.
On a related matter, we're seeing the prospect of a trans-Tasman bubble. What measures would we be looking to duplicate measures? Would, for instance, the COVID app be something we would like to see in New Zealand before we consider a bubble?
I think the considerations around this bubble, as we're talking about at the moment, are in their early stages. I think there are some discussions going on, but I have to say I'm not a part of those discussions, and I think they are very early. But we will, of course, front of mind will be the importance of maintaining this great achievement that we've made in flattening the curve and preventing further spread. And so whatever we do will be done and really considered, and will be done in collaboration with New Zealand.
Would it be good for New Zealand to have a tool like COVID app for its contact tracing?
I think the decision about how New Zealand manages its response is really theirs to make. Each time that a country introduces these type of apps, we're learning from them, and certainly we're seeing other countries across the world starting to think about how they might apply this technology in their response.
In your area in particular, you mentioned a few weeks ago that nurses were being put forward to have more ICU training and that improving the surge capacity within healthcare staff. Can you provide an update on numbers around how many we are able to have trained, and also what happens to them while we're in this state of not necessarily needing them? Are they easily recalled? How will that work going forward?
So if you recall, we announced now some weeks ago up to 20,000 places for nurses to do online training in intensive care and high dependency nursing. We were overwhelmed by the amazing response we saw of nurses willing to step forward to do this training to help Australians. That training has commenced and all of the places are now filled. Those nurses, the skills they'll learn in this course will be as applicable in a general ward situation as they would if we were requiring them to work in intensive care. Because we flattened the curve, thankfully we've not needed them, but we do know that they're now out there and they can continue to consolidate their studies and learning, and hopefully we never need to call upon them, but those skills won't be lost and they'll be a benefit to the community. Any other questions?
If I could just ask one further question, sorry, since you're wheeling. Just in terms of, sorry, I don't have the exact numbers in front of me, but I know at a point quite recently about a quarter of Victoria's cases were made up of people in the healthcare sector or related to the healthcare sector. What kind of numbers are we seeing in terms of our national figure of how many of that figure are made up of healthcare workers?
To be honest, I'm sorry, I can't give you those figures. I don't have those figures to hand. I can say, though, that still we are aware that the largest proportion of the positive cases in Australia are a result of international travel. That, although that's diminishing as we're seeing less people come back to Australia and we're not seeing much international travel, but I can't speak to the actual numbers of healthcare workers, sorry. Okay, thank you for your time.